and I will be performing a Foley catheter insertion on a male. And before I enter my patient's room, I will confirm the order for the right patient and gather my supplies. I will knock on the patient's door and then perform hand hygiene. I will introduce myself to the patient. Hi, my name is Lauren. I will be your student nurse today. May I have your name and date of birth, please? And confirm that with their wristband. I will provide patient privacy, and then I will ask my patient if they understand what a Foley catheter insertion is and the purpose of the procedure. I will ask if they've ever had one done before. Have you ever had a Foley catheter insertion before? Yes, so he knows what to expect. I will clean off my working area. And put on clean gloves. I will take a warm washcloth and cleanse the patient's peri area. And then I will dispose of my gloves and perform hand hygiene. I will now open up my kit. And with the shiny side down, place the absorbent pad under my patient. And then don my sterile gloves. We'll prepare my swab sticks, open up the pack, and make sure that the cotton swabs are nice and lubricated, and open up my water-soluble lubricant. And then I will test the catheter balloon, and I will look to see on the side how many milliliters to inflate the balloon with, and it says 5 milliliters. So I will look to see that the balloon inflates and there's no leaking, and there is not. So then I will retract. And then I will lubricate the catheter tip up to 7 to 9 inches, what I will be inserting. And I will prepare my swab sticks because I'm going to lose my sterile hand when I cleanse the meatus. So with my non-dominant hand, I will, if the patient is uncircumcised, retract the foreskin. And with the urethra facing upwards, I will cleanse clockwise around the tip and discard. Moving back clockwise 12 to 12 around the tip and discard. And one last time and discard. And then I will instruct my patient to take slow, deep breaths, and on the count of 3, I will insert the catheter. 1, 2, 3, and go 7 to 9 inches. And then when I see a return flow of urine, I will progress the catheter about 2 more inches. And then I will inflate the balloon with the 5 milliliters just like before. And disconnect. And then I will gently pull until I feel a slight tug resistance, and then I know that I'm in the right spot. And then I will remove my sterile gloves, since the procedure is no longer sterile. Discard of my gloves, perform hand hygiene, and put on a fresh pair of clean gloves. And then I will secure the catheter to the inner portion of the patient's thigh with enough slack that it won't fall off with moving or walking. And then I will secure the actual catheter bag. I will place the plastic hook on the side of the bed here, and then I will clean up my supplies, discard of them, and then when I go to document, I will document the date, the time, the size of the catheter, how many milliliters to inflate the balloon, the urine return, the color and characteristics of that volume, and how the patient tolerated the procedure.